I think you have to do your homework. I think you have to understand the educational background, the skill set of the particular doctor. And in Barry's case, very talented, very well credentialed, and great reputation. So, in terms of doing your homework on the person, yeah, look at all the background, look at all the written material, et cetera, and then you have to meet the particular surgeon that you're dealing with, and that to me cemented the deal. Meeting Barry, I felt that he's done this hundreds of thousands of times, and yet he made me feel important. He made me feel that my particular outcome was important. And when you go sit in one of the exam rooms, he closes the door, he's talking to you, and he cares about your particular outcome. And he makes the process less scary. I think one of the things that for me in deciding what kind of lens to get and what were my particular needs, Dr. Seibel was very good in understanding what I do for a living, which is a lawyer, and understanding that lots of my work is up close, and finding the range of what did I need to have accomplished? What did I want from the procedure? Well, I wanted to be able to not only do my work, but also do hobby work, which is sewing or needlepoint or whatever. And Dr. Seibel took the time to say, well, then maybe your range, where your optimal range is, and I want to say 22 inches. I can't remember exactly what it was. But there was a choice of lenses, and he walked me through that. He talked to me about that, what would be good for my particular outcome. And I think that the results, the outcome was better than expected. I can do close work, fine work, if you will. I can function totally as a lawyer and read the screen, read documents, etc. But I can also see far away and remarkable. So I have both near and far vision. And coming to the lens that was important for me, Dr. Seibel took the time, talked about it, and we made the decision about what to use. And I'm very happy with the outcome. So the experience about a cataract surgery is the one thing that I would tell everybody is you don't have to be afraid of it when you're in the hands of the right person and you're comfortable with the procedure. In this case, the surgery center was lovely. And if you stop to think about it, it's a weird procedure. Somebody's touching your eye. That's strange. But you don't be afraid. This is Dr. Seibel is so good. He explains everything. Even when you're in the surgery center and you're sitting there and you're waiting to go, he comes by and he makes you feel good and it's not scary. And it really isn't scary. It's you don't feel anything. All you see is this bright white light, and 3 seconds later it's done. And what I would tell you is the results are going to be worth whatever little trepidation you might have. You should put it aside because it's going to be a good thing for you to do, because when you get done, all of a sudden your eyesight is back. I've been wearing glasses since I was in 3rd grade. Nice to not have to wear glasses, not to reach for them in the middle of the night. And it's taken me probably 6 months where I realize when I wake up, "Oh, I don't need my glasses." It's such a strange feeling, and it's so lovely, and it's so liberating. The colors are gonna be better, clarity is gonna be better. You're gonna be able to, at least in my case, and results may vary, but Dr. Seibel has let me I can see up close, I can see far away, and, I wished I'd done it sooner, quite frankly. One of the things that is interesting when you're choosing a surgeon, you expect technical expertise, you expect, the surgeon to have gone to a good school and to have been well trained and to have a lot of experience. One of the things that I think Dr. Seibel brings to the table is a caring that was unexpected. When he meets with you, you're in a consultation room, he closes a door, and he talks to you about what it is that you need and how best to get to it. In my particular case, I needed both eyes done, and he knew that I needed to be able to see in the interim from the time the first eye was done to the second eye was done, because I'm a lawyer and I have to be able to read. And we worked a plan together that let me get that done as quickly as possible, but most importantly, getting the right result for me and getting me back full speed as quickly as possible. And I wasn't patient number 345 that he was seeing that week. I was somebody that was important and my outcome was important. And there was never a sense of being rushed through anything. Questions were answered, and I felt important. So that's the biggest recommendation that I could give. The result is was so amazing. All of a sudden, the colors are better, things are sharper, you're not reaching for your glasses in the middle of the night. I can see up close. I can still do fine work, needlework or whatever, and I can see out into the horizon. I could be killing antelope from 300 yards. So it's an amazing result, and this is one that you have to talk to the surgeon about to figure out what's good for you. So I'm a lawyer, so lots of what I'm doing is up close. I'm reading a lot, etc. And there was a question. Kind of questions that Barry would ask is what's your range? How far away do things have to be? How close do they have to be? And so it was kind of fine tuning me to figure out what I needed to be able to see and be comfortable and do my job.